Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, controlling incontinence. What are my treatment options? Urinary incontinence, which some refer to simply as incontinence, is the loss of bladder control, which causes mild to severe leakage of urine, p. Incontinence is a common and frustrating condition affecting over 25 million people in the United States. It affects more females than males and has various causes, symptoms, and treatments. /r/n/r/n This article describes the types, causes, and risk factors for incontinence in females and males. It also explains how incontinence can be treated and managed with medications, devices, physical therapy, and surgery. /r/n/r/n illustration by Julie Bang for Verywell Health. /r/n/r/n Verywell Health acknowledges that sex and gender are related concepts, but they are not the same. To accurately reflect our sources, this article uses terms like female, male, woman, and man as the sources use them. /r/n/r/n The 5 types of urinary incontinence differ in their causes and symptoms. Categorizing them helps direct the appropriate course of treatment, as follows. /r/n/r/n Incontinence treatment is partly based on results from the Incontinence Severity Index, ISI. This scoring system grades the severity based on how often you have bladder leakage, for example, never, monthly, several times monthly, several times weekly, daily, and how much urine you lose, for example, none, drops, splashes, more. /r/n/r/n Each answer is scored, and the total is added to determine whether your incontinence is slight, moderate, severe, or very severe. /r/n/r/n The loss of bladder control may be temporary and caused by an underlying medical condition. Or, it may be an ongoing or even permanent concern related to the dysfunction of the bladder itself. /r/n/r/n This includes structures like /r/n/r/n Incontinence may also be due to the weakness or dysfunction of the pelvic floor muscles that assist with the voluntary control of urine flow. /r/n/r/n Each type of incontinence involves a range of possible causes, both acute, sudden onset and short-lived, and chronic, persistent. /r/n/r/n Urge incontinence is associated with detrusor overactivity, also known as an overactive bladder, OAB. The overactivity, in turn, may be caused by bladder irritation or the dysfunction of nerves controlling the bladder, referred to as neurogenic bladder. /r/n/r/n OAB affects roughly 1 in 8 people, mostly those over 40. /r/n/r/n Causes of OAB and urge incontinence include, /r/n/r/n Stress incontinence is associated with the weakness of the pelvic floor muscles and/or the urinary sphincters. Laughing, coughing, exercising, lifting heavy weights, or having sex can all increase abdominal pressure, compressing the bladder and causing bladder leakage. /r/n/r/n Unlike urge incontinence, which tends to affect older adults, stress incontinence can also affect younger people, also more female youths than male. /r/n/r/n Conditions associated with stress incontinence include, /r/n/r/n Overflow incontinence is due to the poor contraction of the detrusor muscle and/or the impaired urine flow out of the bladder, known as urinary retention. These things can cause the bladder to overfill until urine leaks out, persistently or with occasional dribbling. /r/n/r/n Unlike other forms of urinary incontinence, overflow incontinence is slightly more common in males than females, due mainly to prostate problems. /r/n/r/n Conditions associated with overflow incontinence include, /r/n/r/n Functional incontinence is when your bladder and urinary tract are functioning normally, but you have physical or mental limitations that prevent you from getting to the bathroom in time. /r/n/r/n Functional incontinence can affect anyone of any sex but is more common in older adults and people with disabilities. /r/n/r/n Conditions associated with functional incontinence include /r/n/r/n Incontinence can affect anyone, but certain groups are more vulnerable to bladder due to risk factors. Some of these factors are non-modifiable, meaning that you cannot change them, while others are modifiable and can be changed. /r/n/r/n Some of the major risk factors for incontinence are /r/n/r/n Incontinence can be frustrating on its own but can be even more challenging when you are out with friends, at work, or participating in sports. The stress may be further amplified when you are traveling or in a sexual relationship. /r/n/r/n You can do several things before and during a public outing to reduce stress. /r/n/r/n Before going out, /r/n/r/n When you are out in public, /r/n/r/n The best way to reduce the stress of incontinence is to prepare an emergency kit for any possible mishap while out in public. /r/n/r/n The emergency kit might include /r/n/r/n The best way to avoid the frustration of urinary incontinence is to seek the appropriate care. Your primary care provider or gynecologist, a specialist in female reproductive health, may be able to help. But a specialist called a urologist is usually best suited to diagnose and treat the different types of incontinence. /r/n/r/n Depending on the cause and severity of your incontinence, the urologist may recommend lifestyle and behavior therapies, prescription medications, and specialist procedures, including surgery. /r/n/r/n Lifestyle and behavioral therapies teach you how to reduce bladder leakage by strengthening key muscles and routinely voiding, emptying, the bladder before leakage is an issue. /r/n/r/n This may involve /r/n/r/n When conservative treatment is not enough to prevent dribbling or leakage, medications may be prescribed to treat the different kinds of urinary incontinence. /r/n/r/n Medications commonly used include /r/n/r/n Chronic or severe incontinence may require aggressive treatment when your health or quality of life is compromised. Some procedures work better than others, and some may be better suited for one type of incontinence but not another. /r/n/r/n Options include /r/n/r/n Surgery is typically pursued in people with moderate to severe incontinence when all other treatment options have failed. Even then, it may not be appropriate for everyone. /r/n/r/n For instance, while surgery can be beneficial for females with stress or urge incontinence, studies suggest that it may increase the severity of urge incontinence in those with mixed incontinence. /r/n/r/n Surgery, like sling procedures and OZ, is generally limited to males with moderate to severe stress incontinence. /r/n/r/n Although some cases of incontinence are transient, passing quickly, others may be a lifelong condition that needs to be managed. Even if there is no cure to your condition, there are things you can do to better cope. /r/n/r/n This includes /r/n/r/n It may also help your peace of mind to discuss your condition with others you trust, including friends and family. This can help reduce the stigma surrounding incontinence. /r/n/r/n If you are not ready to open up to people you know, try connecting with an online support group like that offered by the non-profit Simon Foundation for Continence. /r/n/r/n Urinary incontinence is the loss of bladder control ranging in severity from mild to severe. There are different types of incontinence: stress, urge, overflow, functional, and mixed, with different causes and treatments. /r/n/r/n Urinary incontinence affects over 25 million people in the United States, predominantly females and older adults. Treatment includes bladder training, medications, devices like pessaries, Botox, electrical stimulation, and surgery. /r/n/r/n You can better manage incontinence by losing weight, quitting cigarettes, limiting alcohol and caffeine, eating a healthy diet, and keeping well hydrated with a controlled intake of fluids. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.